Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Monday, April 20th, and this is my daily briefing. We've had a total of 40 cases to date in Missoula County, and that's an increase of 4 cases over the weekend. 38 of those cases were identified by testing, and 2 were epi-linked. We have 26 cases that have recovered, and we've had 1 death, and we are currently monitoring 185 close contacts who are in quarantine. Over 1,500 tests have been completed in Missoula County at this time. The state has had a total of 433 cases and 11 deaths. So last week in the United States, more than 13,000 people died of COVID-19. That's just under 2,000 people per day on average. The U.S. currently leads the world in the number of deaths from this disease, with over 30,000 deaths in the last few months. Some people are concerned that COVID deaths are being overreported to scare people. Some think that the deaths have been misreported as COVID in people with conditions like heart disease, COPD, or cancer. I just want to point out a few things. People with underlying medical conditions, like I just mentioned, are definitely more at risk of complications if they get COVID-19 infection. The complications that arise from this infection can lead to death. That doesn't mean that the person isn't a victim of COVID-19 or that the numbers are being misrepresented. However, it does bring up something that's incredibly important for us to talk about. As you've heard, those with diabetes, heart, lung, liver, and kidney disease are at much higher risk of developing complications from COVID-19. Additionally, those over 65 years of age, those with weakened immune systems, and those who are undergoing cancer treatments, and possibly those with HIV and AIDS, may have a tough time fighting this infection. What people don't realize is that over half of Montanans have some kind of underlying medical condition, and many have 2 or more underlying health conditions. Additionally, over 20% of our state's population is over the age of 65. That means there's a lot of our friends and neighbors and family who are at risk of problems if they get this virus. Preliminary studies are showing that chronic illness does impact the risk of complications. A study in China found that people with 1 chronic illness were 1.8 times more likely to have complications than someone without them. People with 2 or more underlying health conditions were 2.5 times as likely. While a review of these numbers and additional study is ongoing, it's important to think about what these early numbers could mean. In summary, yes, people are dying from complications due to COVID-19 infection. Many of them have underlying health conditions, and a large number of people in Montana are among these groups at higher risk. And being in a rural state, that is really concerning as people getting healthcare can be really challenging. So I want to talk a little bit about telehealth. At times like these, especially if you have an underlying medical condition, taking care of your health is really important, and it goes beyond just staying at home and hand washing. Social distancing doesn't mean that if you have a chronic illness that you shouldn't seek medical care. Now more than ever, you should stay connected with your healthcare professionals, but the good news is that you don't necessarily need to leave your home in order to be able to do that. Several of our local healthcare providers have set up telemedicine resources to get people care, support, and still maintain social distancing and relieve some stress from the medical infrastructure. Our department has created a telehealth resource webpage, and we have information from Partnership Health Center, Blue Mountain Clinic, Providence, Curry Health Center, Community Medical Center, the Missoula Urban Indian Health Center, Western Montana Clinic, Missoula Bone and Joint, Rocky Mountain Medical Center, and Frenchtown Family Medical. On our page, we have which providers are accepting new patients, what types of insurance that they take, and the types of telehealth services that they can provide, and how to make appointments. Please don't neglect your health because you're afraid to go to the doctor or you feel that there aren't options available to you. There are many providers here in Missoula who are able to help you. And as I mentioned before, if you have a chronic condition, it's really vital that you take care of your health. Using telehealth options is a really great way to get care without increasing your risk of exposure to COVID. Please visit our website at missoula.co/cvirus to find that information. Last week, many of you may have seen the pictures that we posted of our epidemiology team from the University of Montana School of Public Health. The data that they've compiled and been analyzing will be available soon. We're creating a webpage on our site for this information to live and to be accessible to the public. For now, we do have an epicurve of the Missoula cases to date and access to the state's report. More local information will be available on our website later this week. So now I want to take a moment to talk about the Sleepy Inn. I don't think that people understand the need for this facility or the approach taken by our department and our partners. We really need a place where we can quarantine and isolate people who do not have a suitable way to do so in a home setting. We need a way to support those affected by illness and provide a space for those being monitored for COVID-19 to prevent additional community spread and the impacts of the health to our community. This is not going to be a medical facility, but rather it would be a community resource. Our incident command team worked with the city and our community partners to make this happen. We also worked out with emergency management experts to get approval from FEMA to use the Sleepy Inn as an emergency non-congregate shelter. This allows the feds to cover 75% of the cost to operate, clean, and maintain the facility, and we anticipate that other emergency funding sources will cover the additional 25% that's not covered by FEMA. The operation of this facility, while a benefit to the community, will not cost our taxpayers. So I just want to make that really clear. Now I want to talk about the concerns that were outlined in a health department email that many of you have probably seen by now. We think a few things are important to point out. Our health inspector's goal, along with other regulatory partners, was to identify the items that would have to be addressed in order for us to be able to use this facility as a non-congregate shelter. The items in that email will be addressed before anyone is ever going to be sheltered there. Using that message as a reason not to use this facility is a misrepresentation of the intent of the visit, and it really fails to recognize that to protect the health of our community, we need a safe place where we can quarantine and isolate people, and that is what this facility would be used for. So I just want to clear that up and address some of the concerns that have come up publicly. Those are the main things that I have for my briefing for today. I just want to say again, thank you to everyone in the community who's following that stay-at-home order. I know it's getting harder as the longer it goes on, and we definitely understand that. We really need to do everything that we can to continue to slow the spread of COVID-19 in our community. So thank you for everything that you are doing to keep yourself isolated as much as possible and following that stay-at-home order. I hope you all had a chance to get out over the weekend, or that you might be able to get out and enjoy the beautiful day today. Please keep in mind that we still need you to follow those social distancing guidelines when you're out on our trails or on our paths, trying to enjoy the beautiful weather. Try to stay at least 6 feet away from other people. More space away from other people if it's available would definitely be better. So I just want to remind people of that. And always you can follow me on YouTube at Cindy Farr, CINDYFARR. Click the notification bell so that you get notified whenever a new video is uploaded. Follow us on Facebook. You can get lots of great information there. It's under the Missoula City County Health Department. I want to remind people that if you are a Missoula County resident or you are a healthcare worker or first responder that works in Missoula County, then and you develop symptoms of COVID-19, please call 258-INFO, select option number 2, and that will get you in touch with a nurse who can help you get scheduled for an appointment at our drive-through testing facility. When you get out there for the test, it's a very quick process. It only takes about 6 to 10 minutes from the time that you pull in until you pull out. And typically we have the results back within 24 to 48 hours. So just remember that that is a resource to you here in Missoula County. You can also call that 258-INFO line if you have questions about COVID-19 or you're wanting to know what kind of community resources might be available to you as far as food or the help with trying to pay your rent. So you definitely use that as a resource, and also check our website at missoula.co/cvirus. And thank you, stay healthy, and I will talk to you again tomorrow.